My name is Susan McLaughlin. I'm a physical therapist, and I've been practicing for a while. I graduated from the University of Utah Physical Therapy program in 2001, so it's been a little bit. I have the fortune right now of having my own private practice. I'm in my 5th year, and my business is named Align. What I offer as a physical therapist is I'm a general orthopedic practitioner, which basically means I work with anything related to muscles and joints, bones, ligaments, tendon. And I also have a specialization in pelvic health. Pelvic health is an area that is looking at anything related to muscles of the pelvic floor and organs of the pelvis. When we're kind of identifying the range and scope of pelvic area, it's really the area from the trunk to the knees. So that is a big real estate. Being able to understand the how the body is moving through space, being able to be aware that in this pelvic area we have a lot going on. We have the lower legs connecting here, trunk, upper extremity via the trunk. And this is where we carry our center of mass. So our center of mass is actually located right in front of that lowest lumbar sacral area. So there's a lot going on here. And typically when we're looking at pelvic health, I think most people kind of the go-to for rehabilitation is the Kegel contraction. So the Kegel is the pelvic floor muscle contraction, and that improves the health of the pelvic floor. Well, really, if you're looking at that to relate it to another area, say the shoulder and a rotator cuff injury, it's not just about the rotator cuff muscles. It's about how the whole system is being used. So it's okay to do that contraction, but we need to look at how we are moving and using our body in the day-to-day. How is the skeletal system aligned? How are the muscles working? How is the blood flow to the area? So there are a lot of factors that we really need to be looking at when we're talking about healing urinary leakage, healing constipation, being able to not have pain with intercourse, to be able to change abdominal separation, diastasis recti, and not only close that gap, but also be able to create effective load across the abdominal wall. How can we be able to use our body better? Those are some of my questions, and that's what I'm really interested in, and that's kind of the standpoint that I take when I work with people in my clinic on a one-to-one. And I also offer prenatal and postpartum workshops quarterly. So these are offered for the prenatal and postpartum to be able to get information about the state of their body and what they can do to create changes, and then also be able to do the movements, do the exercises, and start to feel it in their body. So this is a great, inexpensive way to really do some good self-care. I highly recommend those. I have handouts that I gave to Becky for the birth center, and it has my contact information on it. It has my website, and going to the website under the workshop tabs, I actually have all of the different dates in the prenatal and the postpartum workshop that are going to be offered this year. So I highly recommend taking advantage of that, because people who go to my workshops, I offer a discount also for individual sessions, because sometimes we just need getting the hands on the body to help heal, as well as be able to refine things in just some of that re-education, being able to allow the brain to start to notice more often in a day some of the ways that we're maybe getting in the way of ourselves. I say this a lot. We tend to get in the way as far as creating muscle tensions, creating excessive force or pressures. So a lot of times when we're looking at healing prolapse and healing abdominal wall separation, we really need to be able to be aware of how are we managing our pressures? And how are we using our muscles? Are they even being effective at being able to create and generate force? So these are big issues that a lot of times the healing aspect of it is really simple, but the day-to-day may not be. So what I wanted to do here today is I wanted to be able to go over one of the things that I see day in and day out that will affect not just anything related to issues prenatal or postpartum. This is really for everybody, but in the prenatal and the postpartum time periods, we see just with the changes in the hormones and relaxing that ligamentous stability has changed, and so this is going to affect potentially, this could be the straw that broke the camel's back. Okay, so people might experience pubic symphysis dysfunction or some SI problems, back and hip problems in the prenatal time period, and it might even carry over into postpartum. So this piece that I want to talk about is very simple, but can be really hard to change sometimes because we are so set in our ways. One of the things that I really like to do when I work with people is I want to be able to bring the brain into the game here. So neuroscience, I'm fascinated by it. One of the things that we know about the brain is it needs to be able to perceive things. The information that it gets is really important. And a lot of times, 95% of our day, we're on automatic, so it's not getting new information. We need the brain to start perceiving change, so that 5% of the time that we're mindful, we want to try and make that a higher percentage. So the brain changes when we're in pain. And when we can change the brain, we can change pain. And that's really exciting. So sometimes just the simple things is going to change that information back to the brain. So one of the things that I want to share with you today is finding neutral pelvis. Finding neutral pelvis in standing and sitting. Those two things we're doing all day long. Unless we're sleeping, we're laying down. So sitting and standing, this is something that is, like, honestly for me personally, in my own issues with chronic pain in my back and my hips, this awareness of standing alignment and what the pelvis is doing, hands down, this changed my getting out of pain for sure. So the first thing that I want to do, referring to my pelvic model, is let's take a look at what we are going to identify on ourselves to help us find neutral pelvis. So the pelvis, I think most people, when we're looking at it, think of the pelvis as it situates in the body as like a bowl. It's not that. It's actually, I'm going to go side view, it's actually tilted. So the neutral is the pubic bone and this bony point in the front, the ASIS, are actually vertical. And the beautiful design about this is now we have this shelf to support our organs, bladder, uterus. How wonderful is that? So when we're in positions throughout the day that don't allow this bony shelf, this can really start to make changes to the health of the pelvic area. So I'm going to go ahead and stand how I like to stand, and I'm going to let the model be how I'm standing. So with this model, you can see that it went from a neutral to a tucked back, or we call it posterior tilted position of the pelvis. So I'm going to go ahead and set it down, and I'm going to point to my pubis, I'm going to point to my asis. So I stand with my pelvis shifted forward. You can see that this one is behind and this one's forward. So if I go to look down to the inside of my ankle bones, what I did was I just brought my hips back over my ankles, and now my ASIS, or my ASIS, and my pubis are vertical. So now I have a neutral pelvis, And I'm still looking down just because it's nice to be able to talk about this and really see this line up here. And as I bring my head back, then I can negotiate. So a lot of times this feels super funny. I didn't have to do any sort of bringing my hips back through muscle work. In fact, we don't want to have to really muscle anything in our body. We should stand in a relaxed position. Our abs should be relaxed. Our quads should be relaxed. Our glutes should be relaxed. And our shoulder blades. So that's another area. So we have a lot of things that typically tend to hold tension. And when I say that, a lot of people go, oh no, I don't hold my belly. But when they start to check in, they're like, oh man, I'm holding my belly all the time. Or, oh man, I'm tightening up my glutes all the time. So this is what I call getting in the way of ourselves. So how are we holding tension? Let it go. We should have resting tone of our muscles. I think somewhere, I don't know where, we have this idea that we have to hold on for dear life to support everything. And it's actually just the opposite, because it doesn't allow the proper movement of the muscles to happen. Because if you think about it, every muscle should shorten. That's my bicep shortening. This tricep had to lengthen to allow it to get there. And then this shortens and this lengthens. So there's always this opposition, this give and take. We want to be able to get the body into position so we're neutral and we're relaxed and we're at rest. That gives the fuel for the muscles to be able to generate force when we get there. So the cue is, I'm going to do it again without a bunch of talking. I'm going to stand how I normally do. Or I really check this as often as I can. I'm not 100% at all by any means. I always say I'm a work in process because I have so many things to work on. But it's fun. I feel good. I'm out of pain. And if anyone is in pain, you can get out of pain too, honestly. So my pelvis is forward, and that you see that tilt, the pelvis, pubis, as is are not lined up. I'm going to go to look to the inside of my ankle bones. I get my pelvis into neutral, and then I let my head come up. Now, this here takes practice. There's a lot of nuances, so sometimes it's fun to play with it and then go on and maybe work with someone, work with me. There are many, well, I shouldn't say many, we have a good group of pelvic health physical therapists in the area. I really would highly recommend that if you have something going on from the trunk to the knees, you're having some urinary leakage, you're having constipation, you're experiencing pain with intercourse, you're having some abdominal pains, you're having cramping, excessive cramping around your period. These are things that you don't want to hang on to. Go in, work with somebody. I highly recommend it. It can sometimes be really simple and may not even need very many visits. Sometimes it's a process. So I encourage you, get the help you need because it's out there. Thank you so much for your time.